Say it again.
Does plasma help transport the red blood cells?
You're exactly right. Yeah, the plasma helps to transport the red blood cells. Remember, the red blood cells carry oxygen and carbon dioxide as well as glucose around to the body. If we don't have plasma, and that's basically what begins to leak out, the red blood cells again become thicker, can begin to clot, and they just kind of sit there. So it doesn't get transported. The other thing, right along with what you said, and you did a good job with it, is that blood pressure begins to fall. Remember I said that the body requires a certain amount of pressure in the vasculature in order for the organs to be perfused. Each organ has a different pressure requirement. It takes less pressure to perfuse the lungs than it takes to perfuse the brain or the liver or the spleen. Why would that be? Anybody?
It's further away from the heart. So
Okay, so distance makes a difference. So yes, you're exactly right. So the farther away you go, the greater the pressure that you're going to need. Very good. What else?
Could it be due to like there being more organs in the abdominal cavity, more space in the chest cavity?
Expand on that a little bit because I think you're headed down the right road.
I don't know. Like, I guess to me it just seems like the brain and the liver and the spleen like don't really have that much room to like expand.
Okay, so yeah, you're right. You're dancing. You're just touching it. You're right there. So what we're looking at here with these organs, the brain, the liver, and the spleen, is the density of the organs. These are solid organs, and it takes more pressure to perfuse into a solid organ than it does to perfuse into a hollow organ. Okay. So again, basically what we're looking at here with this kind of this overall blood pressure of 120/80, again, which has traditionally been what we've considered a normal blood pressure, is that's kind of an aggregate blood pressure for the entire body. So just kind of keep in mind, we want to keep our pressure there and we want it to stay there. The other ways that we can lose that plasma is that we can lose it through vomiting and diarrhea. We can lose it through anaphylaxis. We'll talk more about anaphylaxis in just a little bit, but one of the things that happens with anaphylaxis is the vessels dilate and then they get really, really leaky. And so larger the vessel, the less the pressure is going to be unless we increase the volume inside that vessel. But then it's kind of like someone comes along with a nail, Landon, and just begins poking little holes in the vasculature throughout the body. And that plasma begins to leak out. And as a result, that's what causes in anaphylaxis some of the swelling that we would see in our patients. And that also results in a reduction in the blood pressure, Emily. And we have a drop in perfusion for the patient that's going to go on there. We can get patients that have crushing injuries, okay? So basically you could be in a car wreck and have the dash come down on your abdominal area and compress both the liver and or the spleen. And as long as that dash is on there, basically what it's doing is it's putting pressure on those organs and they're not bleeding. But when you lift it off, the patient will crash very quickly. And I'll tell you a story when we get into abdominal trauma about how that happened to a patient of mine actually on Christmas Eve, which made it a whole lot harder. So when we're looking at patients that have elevated fevers, they have nausea and vomiting, especially when we're talking about kids and young kids, watch for how much fluid that they have lost. Jaquan, when we're dealing with kids that are infants that are wearing diapers, one of the first things that we need to ask the caregivers is, has the amount of diapers that the baby normally goes through, has that changed? Has that increased? Has it decreased? And if it has decreased significantly, then we got to begin to think that this child is dehydrated, and that could be potentially the cause of what's going on with this particular patient. Patients can become hypovolemic from sweating. Okay, James, in the summer, if you're working outside, if you're working with a fire department, you're working with a highway crew, you have an outdoor job, temperatures around 100, humidity's right there at about 100 as well. Losing lots and lots of fluid from within the body by sweating also leads to hypovolemic shock. The other thing that comes into play with losing fluid leading to hypovolemic shock, and that's kind of what I was referencing a while ago when you guys were talking about this water diet, is that it really throws your electrolytes off, okay? So one of the things we want to keep in mind is that when electrolytes get off, and the electrolytes are simply chemicals in the body that help the body to work, bad things can begin to happen. And the three principal electrolytes that you and I are going to be concerned about for patients is going to be calcium, potassium, and sodium, okay? And that's why I said when you were talking, I said, boy, that kind of diet can really mess your electrolytes up, because basically what you're doing is you're taking a lot of water in, you're diluting the amount of electrolytes that are there, and then you begin to pee it off. The same thing happens when you're sweating. Same thing can begin to happen when you begin to lose that plasma by way of burns or through anaphylaxis, where it begins to kind of leak out. And so we've got to watch our patient really closely for signs and symptoms of electrolyte imbalances. So we look at these patients and we address them very, very closely and very carefully as far as when we're looking at them. So again, Juan, let me throw this one to you. If you've got a patient that is dehydrated and you suspect that they're in hypovolemic shock from dehydration, what do you think might be some signs and or symptoms that you would see on this particular patient?
And they're like in the middle of shock.
Yeah, they're in shock.
Would temperature also affect them too?
Yeah, if they're dehydrated because of sweat, because of temp outdoors, so yeah, the heat and humidity would have a thing to come into play with that as well. Landon, can you help him out a little bit? What would be something you might see? Why would they have pale skin? So let's look at this a little bit deeper. You're right, but tell me what's causing the pale skin? Yeah, so remember, when we go into shock, it doesn't matter what flavor of shock your patient is in. One of the very first things that happens is blood begins to be shunted away from the arms and the legs in towards the core, and again, just like Landon said, with a specific destination of the brain, heart, and kidneys in that order. Now, the other organs within the body core are going to be a high priority for perfusion as well. But those three are going to be the top three. So that's why we would begin to see the skin, and not just the skin of the extremities, but the skin of the core of the body as well, would now begin to look pale, okay? Remember, so red blood cells, regardless of what culture or race that you're from, it's the red blood cells that help to give you your skin color, okay? And so as those begin to retreat, now we will all begin to become more of a lighter color. Now, with people of color, obviously, we're going to look in different places. Again, we'll look at the palms. We can look at the soles of the feet. We can look in their eyes and begin to see if the mucous membranes around the eyes are nice and pink, or if they are kind of a pale looking pink. We can look at, for all people, we can always assess the lips, regardless of what color your skin is. And so that's one of the important things that you need to remember, is the skin is the largest organ in the body. And it gives us a ton of information about the perfusionary status of our patient, okay? Good. Lincoln, what would be another sign or symptom that you would think that you would see in a patient who is in shock from dehydration? What kind of blood pressure? So would it be high or would it be low? Anybody? Nico?
Would it be low
Why?
because of the dilation of the blood vessels?
Okay. I will tell you, you're both right. It's kind of like, okay, Dr. Young, you've lost your mind, which is entirely possible. When the patient first goes into shock, they begin to compensate. So their blood pressure may actually go up. And we'll talk about the stages of shock here in just a few minutes. So your answer about the blood pressure going up in the early stages of shock is correct, okay? But we will see some other things that will begin to come into play. Nico, yours is also correct because as the patient, if we don't address it and we can't fix the shock problem, as they progress, the next stage that they will move into, their blood pressure will begin to fall. And for the very reason that you're talking about, not because they're losing blood, but because they're losing that plasma and the size of the vessel is too large to maintain an adequate blood pressure, all right? So kind of hold on to that and we'll talk more about that as far as we look. When we're looking at patients that are dehydrated, one of the things that we want to assess on their skin, again, skin gives us good information, is the skin turgor, Turgor, skin turgor. On a normal person, if you have them just kind of lay their hand in a comfortable resting position, you don't want them to extend it and put it down flat like that, but just in a normal, comfortable resting position, what you want to do when you're assessing for dehydration is to take the skin, pinch it like this. In a properly hydrated person, it goes back and it resumes a flat area in about 1 to 2 seconds, okay? If you got a dehydrated person, Yusef, that tint that you called it, and we call it skin tinning, will stay up there for 5 to 10 seconds. Why? Because the fluid has been shunted away from the skin. And this tells us that our patient is going to have, be dehydrated. You can look at their eyes many times. If the eyes look kind of sunken and hollow, that's an indication of severe dehydration. That generally, Jack, is going to take several days for that position, that particular thing to happen. Look in their mouth, okay? The mouth obviously should be nice and moist, but if you see kind of like fuzz on the tongue, because that's what happens when the mouth gets dry, that's another indicator that we've got an issue going on with dehydration. When we're dehydrated or when we're in the early signs of shock, basically what we're looking at is one of the first things happens is that the heart rate will go up. And the heart rate, Yusef, may be as high as 15 to 20 beats above what a normal resting pulse would be.